We had a significant debate back 20 years ago when we were deciding whether we wanted to put drive-throughs on our pharmacies, right? You know, some people would say, how can you do that? You know, people are going to drive through and not pick up anything in store. The other half would say, well, if that's what the customers want, let's do it. And obviously today, probably 80–90% of our stores in any corner drugstore has a drive-through. So with that said, it's really more about any business. How do you offer what the consumers want? Right. And then how do you integrate it into your overall business model?
Greg Wasson started his pharmaceutical career as an intern for Walgreens in the 70s, climbing the ranks to CEO and transforming an iconic brand in the process.
We're seeing 40% of our traffic, web traffic, coming from smartphones. We're seeing about 10% coming from tablets, and that's growing. And 50% of the people who are using our smartphone app are using it right in the store. So I can assure you that Walgreens is one old retailer that gets the digital revolution. We have to. Our customers are driving it, and we need to stay ahead of that.
Wasson spearheaded acquisitions of Duane Reade and Alliance Boots and created the world's first global health and well-being company, changing an entire industry for generations to come.
We had three big growth strategies. One was to create what we called the well experience. That meant reinventing the front end of the store. The second was to advance the role of the community pharmacy. And three was to find us, if one existed, a strong international partner. The transformation, the change that we had to lead to pull that switch off from going from opening stores in every corner in America to what I just described was exhilarating, challenging, difficult to say the least, but I think has set the Walgreen Company up, I hope, for the next 2 decades, if not a century.
At the helm of a major healthcare player when the industry was changing dramatically, he offers a unique insider's viewpoint into the state of healthcare today.
70% of the people in this country today either don't have or don't utilize a primary care physician. And a lot of the reason is because of the lack of access or of convenient primary care physicians. You know, the point was convenient locations, front line of healthcare, 2 healthcare professionals, pharmacists and nurse practitioners. I know there's some controversy about that, but they could, if they're allowed to operate at the top of their license, can do a lot, to kind of fill that gap and that need and the shortage of primary care. And we found out quickly that the public values and trusts the pharmacist to do more than just dispense their medications, which still is their #1 priority. So immunizations and vaccinations, health screenings, cholesterol testing, blood pressure, everything that's really focused on wellness.
With firsthand experience growing a wellness company at home and abroad, he offers solutions for controlling costs and improving patients' overall health.
Countries around the world are looking to control healthcare costs. We know that one of the best ways to control healthcare is to keep people adherent and compliant on prescription drugs, and with the advent of generic drugs and that increasing, it's the best way to keep people healthy and lower healthcare costs. There is a tremendous opportunity for the entire industry, retail pharmacy, to not only expand the role that pharmacists can play, but also co-locate additional healthcare professionals.
It's a human business legacy we want to leave behind us.